How many people have tried
Oh,
massage, therapy, chiropractic with no results, including myself? In fact, I went into chiropractic college to try to fix my shoulder problem, and it
all right, YouTube. What's up? What's up? I'm back again with another video. In today's video, I'll be reacting to Dr. Berg's video on the real cause of neck and shoulder pain. You know what I'm saying? Have you been experiencing neck and shoulder pain? So let's hear what Dr. Berg has to say. Let's get right into it.
back pain, your shoulder pain, or even like your pain in the back part of your scapula, it's probably not coming from your spine. How many people have tried
Oh,
massage, therapy, chiropractic with no results, including myself? In fact, I went into chiropractic college to try to fix my shoulder problem, and it never worked. Why? Because I was treating the symptom. I did not understand the connection between this area of your body and the gallbladder. Don't worry, I'm going to show you a technique to determine if you have this problem or not. It'll probably take 30 seconds or less, but you really need to understand this connection and how it works. I've been in practice for 30 years, worked on over 40,000 people. 80% of
wow. This will be quite interesting. I thought all those massages actually does help. You know what I'm saying? But you say you are just like massaging the symptoms and not really the real cause, right? I thought that actually do help. I thought it does help, right? But I think what he's trying to do in this video is like to like help us fix the real pain. You know what I'm saying? So let's keep watching.
tightness, spasm, pain in this whole area.
Okay.
This is where you might feel it, but it's not coming from this area. Because the problem in healthcare in general is they don't really look at these connections. Let me just first answer the question why your gallbladder or liver might be creating such problem for you. The gallbladder is the little sac that hangs underneath your rib cage, and it has a connection that goes to your small intestine, and also has another connection or a little tube that goes to the liver. The liver makes something called bile that trickles down and then goes into the gallbladder to make it really concentrated. So then when you're ready to eat, it can contract, push the bile into the small intestine, and help you break down fats. What's the relationship between bile and this pain in our right shoulder?
Exactly. Because I actually want to know like what does the bile has to do with the pain or the impingement that I'm feeling at my back or at my neck. You know what I'm saying? So let's find out.
Area right through here. Bile is made out of cholesterol and bile salts. If your cholesterol is very, very
Oh,
high and your bile salts are very, very low, you get what's called gallstones. But there's a very important stage before you gets to a gallstone. That is basically bile sludge, and it clogs all the pipes up and it creates a lot of pressure, triggering the phrenic nerve that goes right up into this side right through in here, referring the pain down through here. I'm not sure if you can really see this, but this is the phrenic nerve. It goes to the diaphragm. Right above the diaphragm, we have something called the liver, right through in here. This is the liver. Underneath the liver, you have this thing called the gallbladder. If you look up what the phrenic nerve does in Wikipedia, this controls breathing because the diaphragm is a muscle that contracts and it pushes the lungs up and it brings it down, etc., etc. A lot of people also don't realize this nerve doesn't just control the diaphragm. It sends sensory signals back up to the neck through here. So it's kind of a two-way flow. And there's sources that show that this nerve also connects to the gallbladder, but also the outer portion of the liver. If there's any congestion or swelling or anything that will enlarge the gallbladder or liver, causing what's called referred pain in this area. This problem is so common and it's so easy to fix, but you can't get it fixed with surgery, drugs, chiropractic, physical therapy, or massage. It's a purely dietary thing, and I'm going to show you in a little bit how to
wow.
test for it.
For real, I will actually say this is like my first time hearing about a dietary part. Like I've never heard like fixing your diet and can actually help with your back pain and neck pain. This is like my first time hearing it. So, but let's see where he's getting at this because for real, I actually thought massages or physiotherapy is like what gets the job done. You know what I'm saying? So let's keep watching.
To determine if this is your problem, and you'll know within 30 seconds. In reality, it's a deficiency of bile. What causes that? A
Oh,
big one is estrogen dominance. When some women take estrogen replacement therapy or even birth control pills, that's one of the causes. Another cause is medications, especially statins, antibiotics, and antidepressants as well. You can imagine what that does to your liver. If the liver is damaged, you can't make enough bile to prevent this problem. Of course, other things can cause it as well. Drinking too much alcohol, eating junk foods, carbohydrates, sugar, starches, grains. If that's what causes it, how do you get rid of it? One thing is eliminating those key things I just mentioned, but also there's a very powerful remedy, taking bile salts called TUDCA. TUDCA will start to thin that sludge. It helps reduce the fat on the liver, and it's also good for your eyes, for your brain, and for the pancreas. But of course, a lot of times it's just a matter of changing the diet and not necessarily adding anything except this one thing called taurine, okay? Because bile salts are made from taurine. Now the question is, do you really have this problem or not? There's a very quick way to find out. What you're going to be doing is you're going to be manually massaging this area to take some of the congestion out. And if this is the reason why you have a problem, you're going to feel instant relief on the right neck and shoulder area, or even in your scapular area in the back, or even if you have pain down the right arm.
well, this is quite interesting. This is quite interesting. When you start messing with your system or like take some certain medications, estrogen, and some of the other stuff you mentioned, this that could lead to this. I don't know. Sometimes I tend to feel some back pain, some impingement. I feel like at times it's due to my sitting position or like my posture and all that. That's why I tend to get those pains. I'm not really with what I eat. You know what I'm saying? Not really with what I eat and all that. So this is quite interesting right here. Or you can also give it a try though. You know what I'm saying.
It's almost instantaneous. So what you're going to do is you're going to take your hands and you're going to press like this up underneath your rib cage, back and forth to the point where you feel a knot, okay? And you're just going to hold pressure there, and then you're going to start noticing your right shoulder and see if it loosens up. I'd say over 80% of the time you're going to notice like a...
I just tried it out right now and I actually didn't feel any relief for real. Right here. I didn't feel any relief. Let's keep watching. Because what I'm saying so is like I have like a neck pain right here. So it's not like I'm trying to discredit him. I really have a neck pain, like back pains and all that. So I'm trying to see if this is for real. Let's keep watching though.
instant relief. Then this will give you an idea that the root cause is not coming from right here, it's coming from down here. But the ultimate correction is changing your diet. Ultimately, you are going to run into someone that you know, or even yourself, with this problem, and now you have a very powerful tool. I want you to tell me down in the comments if it did work or not for you. Check this out. This is a textbook, Bile Salts in Health and Disease, filled with gold information. Check this out. A long time ago, they didn't really know what bile did. He said that bile had no advantage at all, but the greatest damage results in it staying for a long time in the body. That can irritate the internal lining of the liver, that can back up into the blood and create a lot of problems. And when it's flowing, everything is good, but when it's stuck in the body, everything is bad. It's also very interesting if you go back to the ancient Greeks, like 500 BC. They were studying bodily fluids. What was interesting back then is the bile was one of the fluids that they used as an indicator for health or disease, but they didn't really know what it was until mid 1800s, because at that time they were able to extract it and actually use it to clean grease off of your hand, comparable to a detergent or a soap. Then they had the connection, oh, it can actually help you break down fatty foods. You do need enough zinc and magnesium as cofactors to help you make bile. But what if you don't have a problem with this bile thing I just mentioned? What if you're the 20% that actually has pain in the neck or the shoulder? What do you do then? Well, I have just a video for you right here.
Wow, this is quite an interesting one. I never knew that, from his perspective about like working on your diet so that it will help you with bile, for your bile not to get stuck in your body. Because when the bile, that's basically what he's saying. When the bile gets stuck, instead of to keep flowing as it's supposed to be, it tends to like cause an impingement and give you the neck pain or the back pain. So I guess he's saying working on your diet is really, really important. That's quite interesting. But to me, I feel like massages, physiotherapy actually really does help. You know what I'm saying? So basically, you have to see your doctor and know if you have the buy challenges or whatever. So so good though. So good. Quite an interesting one. First time hearing about the buy having to mess with your neck pain and shoulder and back pains. You know what I'm saying? So yeah, what an interesting one. So if you like this video, don't forget to give it a thumbs up, drop your comments, subscribe, and see you in the next one.